Hello, my name is Hadi Rahim, and welcome to Medicare-for-All Mondays, the show where every Monday we dismantle some of the best and worst arguments against the U.S. adopting a single-payer universal healthcare system. Medicare for All. Medicare for All is the name of the proposed single-payer universal healthcare system that progressives want to implement in the United States. It would take the existing Medicare program, expand it to all people regardless of age, and eliminate cost sharing, which means making most services free, just like almost every other developed country in the world. It's more efficient, it's less costly, and it's just overall better. However, a lot of wealthy and powerful people would have you believe the opposite. This Monday, we'll be dismantling probably one of the single worst arguments against Medicare for All. That it would make America fatter. The argument is essentially that if healthcare was free, there would be no incentive to stay healthy.
If these are the poorest Americans who are getting their co-pays and things like that covered, what's the motivation for them to try to live a healthier lifestyle? I mean, if it doesn't cost them anything to go to the doctor, what's the motivation?
If you are morbidly obese in the United States, it is your responsibility, or should I rather say, your lack of responsibility. It will reflect itself within the costs you pay to whatever insurance company you sign up with. You pay the consequences, not just in diabetes and cardiac arrests, but financially.
But it is not my job to pay for your health care, because if I'm paying for your health care, that creates a perverse incentive system where you can go make a bunch of decisions that are not great for your health, knowing somebody else is going to pick up the tab.
Yes, and I'm gonna burn down my house because the fire department is free. This point makes no sense for several reasons. First off, if this were really the case, America would be the healthiest country in the world. I mean, think about it. We have the most expensive healthcare in the developed world. If high insulin prices really incentivized people to get on that treadmill to fight off type 2 diabetes, then every American would be jacked. But we're not. If this was the case, Europeans would be the fat ones. After all, what's motivating them to be healthy? Oh wait, America ranks number 1 in obesity among OECD countries? It's almost like people don't work like that. People don't eat healthy and work out because they're terrified of medical bills. People do those things because they don't want to be fat. People aren't morbidly obese because they don't care about co-pays and deductibles. They might have mental health problems or don't have cheap access to healthy food or a gym. Like, if this were really true, poor people would live longer than rich people. But the opposite's true. Third, what kind of sociopathic person would want to live in a world where people would only try to be healthy because they're scared of going bankrupt and losing their house? It's a pretty dark world to live in. Fourth, why is this argument only used against poor people getting healthcare? Elon Musk is worth over $200 billion. He would easily be able to afford any of the top doctors, healthcare procedures, drugs, and specialists. What's his incentive to be healthy? Hospitals should charge rich people millions of dollars because otherwise they'd be fat, lazy, and ill. Wait, rich people live longer and are healthier than poor people, and countries with universal healthcare are generally healthier and have longer life expectancies? Gee, it's almost like this argument has no merit whatsoever. Look, healthcare is a human right, and whether you're tall or short, thin or fat, rich or poor, everyone deserves quality care delivered with dignity. This won't be the last time you hear this argument, so my advice, don't fall for it.